Do I get health insurance after being laid off? Getting laid off is stressful enough. Suddenly your paycheck is gone, and one of the first questions that pops into your mind is, what happens to my health insurance? In the US, where many workers get coverage through their jobs, losing employment can feel like losing health care too. The good news is that you usually have options. Federal law, through something called COBRA, often lets you keep your job-based coverage temporarily. The Affordable Care Act marketplace and state programs may also give you affordable alternatives, depending on your situation. In this video, I'll break down exactly what happens to your health insurance when you're laid off, what choices you have, how much they cost, and how to avoid gaps in coverage. Let's start with the basics, what the law says about keeping your employer health plan. Part 1. COBRA, Continuing Employer Health Coverage. The main law that helps workers keep health insurance after job loss is the Consolidated Omnibus Budget Reconciliation Act, COBRA, passed in 1986. COBRA requires many employers to give former employees and their families the option to continue their job-based health coverage for a limited time after employment ends. Who's covered? COBRA applies to private sector employers with 20 or more employees, as well as state and local government employers. Federal employees are covered by a similar program, not COBRA. How long does coverage last? Typically, you can continue your employer health plan for up to 18 months after being laid off. In some situations, like disability or certain family circumstances, the coverage can be extended to 29 or 36 months. What does it cost? Here's the catch. Under COBRA, your employer no longer pays its share of the premium. You'll usually have to pay the entire premium yourself, plus up to a 2% administrative fee. That means your monthly cost may jump significantly. For example, if your employer plan cost $500 a month, with the company paying $350 and you paying $150, under COBRA, you could now owe the full $500 plus the 2% fee, over $500. How do you elect COBRA? Your employer or health plan administrator must send you a notice of COBRA eligibility within 14 days of your layoff. You typically have 60 days to decide whether to enroll. If you do, your coverage is retroactive to the day you lost your job, so you won't have a gap. Example, imagine Sarah, who works for a company with 100 employees. She's laid off in April. Within 2 weeks, she receives a COBRA notice. She elects coverage within 60 days, and her health insurance continues without interruption, but now she pays the full cost. The takeaway: COBRA can keep you covered, but it's often expensive. That's why many workers also consider alternatives. Part 2. ACA. Marketplace. Affordable alternatives to COBRA. While COBRA gives you continuity, it's expensive because you pay the full premium. That's why many laid-off workers look to the Affordable Care Act, ACA marketplace, as a more affordable option. Special enrollment period. Normally, you can only buy ACA marketplace coverage during open enrollment. But losing your job-based health insurance qualifies you for a special enrollment period. That means you can shop for a new plan outside of the usual window, as long as you apply within 60 days of losing coverage. Subsidies and tax credits. The ACA was designed to make coverage affordable. Depending on your income, you may qualify for premium tax credits that lower your monthly cost, cost-sharing reductions that reduce deductibles and co-pays if you choose a silver-level plan. For example, if your household income is around 150% of the federal poverty level, you could pay as little as $0 to $50 per month for a basic plan after subsidies. Even higher incomes may qualify for significant discounts. Range of plans. The marketplace offers a range of bronze, silver, gold, and platinum plans. Bronze plans have lower premiums, but higher out-of-pocket costs, while gold and platinum plans cost more monthly, but cover more when you need care. Coverage start date. If you sign up promptly, coverage can begin the first day of the month after your prior coverage ends. For example, if you lose coverage on May 15th and apply on May 20th, your new ACA plan could begin June 1st, avoiding a major gap. Example: let's take John, who earned $45,000 a year and was laid off. His COBRA premium would be over $600 per month. On the ACA marketplace, with subsidies, he finds a silver plan for $180 per month. The network is different, but the cost savings make ACA coverage a better fit for him. Why ACA can be better than COBRA: lower monthly premiums if you qualify for subsidies, options to choose a new network or plan level, no retroactive cost burden, coverage starts the month after you enroll. The trade-off is that you may need to switch doctors if your old providers aren't in-network. Still, for most laid-off workers, ACA marketplace plans are a cheaper alternative to COBRA. Part 3. Medicaid and state programs. Safety nets for low-income workers. For many workers, a layoff doesn't just mean losing health insurance, it also means a sharp drop in income. That's where Medicaid and other state programs come in as critical safety nets. What is Medicaid? Medicaid is a joint federal and state program that provides free or low-cost health coverage to people with limited income. Unlike COBRA or ACA marketplace plans, Medicaid often requires little to no monthly premium and covers a wide range of services, including hospital care, doctor visits, prescriptions, and long-term care. Who qualifies? Eligibility depends on your income, household size, and state. Since the Affordable Care Act, ACA, most states have expanded Medicaid to cover adults with incomes up to 138% of the federal poverty level, FPL. That's about $20,000 per year for an individual, or $41,000 for a family of 4, figures updated annually. But not every state expanded Medicaid. In non-expansion states, eligibility may still be limited to low-income parents, pregnant women, children, or people with disabilities. How to apply? You can apply for Medicaid through your state's Medicaid agency or through the federal ACA marketplace at healthcare.gov. If you qualify, you can enroll at any time. There's no restricted enrollment period, like with marketplace plans. Coverage often starts retroactively up to 3 months before your application, if you were eligible during that time. State-specific programs. Some states also run their own public health insurance programs beyond Medicaid. For example, New York offers the Essential Plan for residents with incomes just above Medicaid levels, with very low premiums. California runs Medi-Cal, which covers millions of residents, including many adults who became eligible under ACA expansion. Massachusetts has Mass Health, which provides comprehensive coverage to low and middle-income residents. Example: consider Lisa, a single mom laid off from her restaurant job. Her income drops to $15,000 a year while she looks for new work. Instead of paying $600 for COBRA or $200 for a marketplace plan, Lisa qualifies for Medicaid in her state. She pays nothing monthly, and her children also get coverage under the Children's Health Insurance Program. CHIP, key takeaway. If your income after a layoff is modest, don't overlook Medicaid. It's one of the most comprehensive and affordable options, and you can apply anytime. Combined with CHIP for children, Medicaid ensures that families don't have to choose between healthcare and basic living expenses. Part 4. Practical steps. Choosing between COBRA, ACA, and Medicaid. Now that we've covered the three main options, COBRA, ACA Marketplace, and Medicaid, let's talk about how to decide which one makes sense for you. Each option has pros and cons, and the right choice depends on your income, health needs, and budget. Step 1. Review your COBRA notice. If you worked for a company with 20+ employees, you'll likely receive a COBRA packet within 14 days of your layoff. Look at the monthly premium cost. Ask yourself, can I realistically afford this amount while unemployed? COBRA may be the best option if you're in the middle of treatment or want to keep the exact same doctors and network. Step 2. Check ACA Marketplace plans. Go to healthcare.gov or your state's exchange. Enter your household income and family size to see if you qualify for subsidies. Many people are surprised to find marketplace plans much cheaper than COBRA. For instance, someone who earned $50,000 last year, but expects to make only $25,000 after being laid off, may qualify for significant premium tax credits. Compare deductibles, copays, and provider networks before deciding. Step 3. Explore Medicaid eligibility. If your income has dropped dramatically, Medicaid might cover you at little or no cost. Check your state's income limits, especially if your state expanded Medicaid under the ACA. Even if you expect to find another job soon, Medicaid can fill the gap so you don't go uninsured. Step 4. Consider timing and continuity. COBRA coverage is retroactive, so you won't have gaps if you elect it within 60 days. ACA coverage usually starts the first day of the month after enrollment, so you may have a short gap unless you bridge with COBRA. Medicaid coverage can sometimes apply retroactively up to 3 months if you were eligible during that period. Step 5. Factor in family needs. If you have children, remember the Children's Health Insurance Program, CHIP, may cover them even if you don't qualify for Medicaid. CHIP provides low-cost coverage and is available in every state. Example: Mark, a software engineer, is laid off. COBRA would cost him $750 per month. On the ACA Marketplace, with subsidies, he finds a silver plan for $220 since he's not in active treatment and his doctors are in network with the new plan. ACA makes the most sense for him. Key takeaway: don't just default to COBRA because it's familiar. Take time to compare cost, coverage, and continuity. A little research can save you thousands of dollars and ensure you and your family stay protected. Losing your job doesn't mean you have to lose your health insurance. Thanks to laws like COBRA, the Affordable Care Act Marketplace, and programs like Medicaid and CHIP, most people have options to stay covered. COBRA lets you keep the same plan but is usually costly. ACA Marketplace plans can be much cheaper, especially with subsidies. Medicaid and CHIP provide low or no cost coverage if your income is limited after a layoff. The key is to act quickly. Deadlines are strict, and missing them could leave you uninsured. Review your COBRA notice, check marketplace subsidies, and see if you qualify for Medicaid. If this video helped clarify your options, hit like, share it, and subscribe for more guides to workplace law and benefits.